Welcome to the Prison Pharmacy Connect show. My name's Kaniksha, your host for the show, and today I have with me Harpreet, a fellow pharmacist. Hi Harpreet, welcome to the show.
Hi Kaniksha, thank you for having me.
Would you like to tell us a little bit about yourself, what you do?
I basically specialize in menopause, and I have a mission, like a lot of people out there, to try and educate as many people as possible when it comes to menopause, when it comes to lifestyle treatment, just to try and make as many women's lives better for longer, and to ensure that men get educated as well about it so that they know how they can help those around them. With that, I've opened a clinic, a menopause clinic, and alongside that, I also help workplaces to get things in place for their team to create the right culture, allow women in that stage to thrive.
For me, as a young person, I probably wouldn't know how to help someone who's going through menopause, even women to women. There are women of all ages in prison, and some people are under the IPP sentencing, which is the indeterminate prison sentence. So they don't really know when they're going to be coming out. And for people who are in prison for such a long time, or even just in prison late in their life, they're juggling so much. As it is, you're worrying about accommodation, about finances, all these sorts of things, mental health. So I suppose one of the things that I probably want to dive into really is, how can a woman understand her own body, understand what menopause is? How can she help herself when she's undergoing these changes, particularly in like a secure setting as well?
Yeah, definitely. I'm really glad that you brought this forward, because I think a lot of the narrative around menopause education is around things like women, they have children who are going through a lot, they have elderly parents, they have careers and all of that. But actually, if you think about it, with the sector that you're talking about, we've not actually touched upon what the general life basics that they may be struggling with. Like you're saying, finding accommodation, all of the things that sometimes we would take for granted. And then on top of that, your body's, hey, hello, I'm going through something as well. We generally, as women, plow through it because that's just what we do. Like whatever's going on, we just crack on with it. And I think the biggest thing that we can do is educate women, people about their bodies. And it might even be just a conversation about, this is what will physiologically happen, and these are the signs and symptoms that you may experience. But to know those signs and symptoms, I think you also need to know generally what your baseline is. So understand, do you normally have low moods during your menstrual cycle? Do you normally have food cravings in your menstrual cycle? Do you normally feel fatigue in your menstrual cycle? And to know that, then you can go on to understand if something's a bit off. You'll start to feel, oh, hang on, I'm feeling a little bit of low mood all the time. But if you're saying, in terms of the demographic that we're looking at here, that there's a lot of mental health issues around that area, then how are we going to educate women to know as much as they can about their body? Actually, it's about listening to your body. And it's really hard to do when you've got all that noise out there for all the things that you have to do to survive or your everyday. But it's about having that dedicated space to pinpoint and to really home in on those women who have been in prison or who are in prison. And I don't think there's much out there for that. So firstly, thank you for bringing it to the attention of your listeners. But that's something that I think requires a more strategic approach in terms of a specific approach.
I do agree. I think that people are looking into menopause clinics in prisons. There does need to be something there to support women, because there are women that probably might have menstrual cycles but don't even understand their bodies. They won't associate certain symptoms with the menstrual cycle as it is, to be able to make that connection that actually this might also be maybe related to menopause. I was just wondering, have you ever come across this where you have actually had to help someone to really understand their bodies? What sort of things can women do? Is it just looking for patterns, writing things down, or maybe having people, friends who they trust, to sort of monitor them?
Yeah.
What would you sort of suggest?
I think in the first instance, it's always about monitoring yourself. So as much as you can, I will say to friends, family, patients, keep a diary, literally, of how you feel when your cycle is. Are you feeling a low mood? Are you feeling irritable? Are you feeling anxious? Do you suddenly want to eat a lot? And actually track that. I think tracking is so important. And I think there's a lot of apps there that will help women track their cycle and their mood and I think gut health is really important as well. So how are you feeling after eating certain types of food at specific times in your cycle, which sounds really like how much am I supposed to record? But actually, the more you do, the more you'll understand what is triggering you, what is making you feel low. So I have a lot of women who ask me, how do I know if I'm feeling low because I'm in perimenopause or menopause? Or am I actually really low? Do I have depression? So essentially, I would say track that. If you're feeling low mood in a cyclical way, then chances are it may be something to do with your hormones. If you're having low mood all the time, then that may be something else going on, in which case you may require a different avenue of kind of help. So when I'm looking at workplace and the things that we can do to help women thrive in the workplace, that's something we can actually apply to prisons. So how is it managed in terms of what the ladies have to wear? Is it breathable? Does it make them feel hotter? Do they have access to fans and AC? Do they have spaces where they can actually have a timeout and talk to someone if they're feeling a bit overwhelmed? I'm not versed within that sector, but all of these things are really important in implementing it to allow women to, number one, understand their bodies, number two, have an avenue where they can actually start to feel better. It's a natural process, and support is so important in any sector for a woman to start to understand what she's going through and also to not feel so alone. And this is why I think when you mentioned the groups that they have, if there's a support group specifically designated for women's health, that would be a really helpful thing. Sit down, talk about it. And actually, when I've done group consultations, you have 5 women in a room and they're like, oh yeah, I feel that too. And then the other person's, oh yes, I feel this. Do you feel this? And there's that great comfort in knowing that you're not going through it just you. And that's something that could probably be applied in that sector.
Very true. I think peer-to-peer support is always useful and definitely has its place in prisons. They have that for alcohol recovery programs. And I think that would be very useful for women to help themselves navigate what's going on.
Yeah.
But they wouldn't be able to use apps because, again, no phones.
Yeah.
I'm just trying to think. I'm not sure if they do have fans in women's prisons. They might do. They might be able to purchase it from the canteen. I'm not sure.
Yeah.
But I think there is some limitation in terms of what they can wear, what they can't wear, what is available, what's breathable for them, what is irritating them. I think that takes a very holistic
100%.
approach.
Yeah. The things that are really important within the menopause space, which I think is generally helpful in any healthcare setting, is like your pillars of health, which is like inclusive of sleep, nutrition, a social connection. Like all of these things are really important in any stage of your life, but I feel like they really benefit women within this specific stage, because it's like your body's knocking on the door saying, okay, you really need to think about me right now, because we will take the time out for our children, for our parents, for work, and we do often put ourselves in the back burner, or back footing, should I say. And it's a time where our body's asking us to listen. How do we navigate that in the prison space? Like you're saying, they've got so many things going on. So a dedicated space where somebody could get one-to-one advice or even like group consultations, because the way everybody experiences it is so different, and it's different to your ethnicity. You'll experience different signs and symptoms. Also, trauma has a massive impact in terms of how your body deals with all the physiological changes. If you generally have a high cortisol level anyway through trauma or past experience, that actually tends to get heightened because estrogen is so important in regulating that system. So that when it declines, it's harder to process that stress, and anxiety might be more heightened. Feeling of irritability might be more heightened. Low mood might be more heightened. On top of that, again, I don't know in terms of what food is available within the prison sector, but the way your gut changes, the microbiome changes. So then the foods that they're eating, is it actually irritating them? Is it making them feel bloated? Is it making them feel worse? And you can eat something before You go through this perimenopause, menopause, and then you can't eat it after. But is that being looked into? It probably isn't. And that will have a real big impact on how the woman feels.
Yeah, the brain and the gut, they're very heavily interlinked, aren't they?
100%. Yeah, 100%. It's hard enough as it is on a day-to-day basis, but I can imagine it being even harder for women who are in prison. Even those women who are not in that stage, I think it's really important that women know about it, even in their early 30s. It's so important that you know what is going to happen. Like, we're taught at school what's going to happen in puberty. Why are we not taught in our late 20s, early 30s what's going to happen when we hit perimenopause and menopause? It's huge. And even as healthcare professionals, it's always about reproductive health. What happens when somebody's going through puberty or when they have children, like what is happening when they're pregnant, all of that, but nothing after. These are the things that I've learned, because for me, it's a massive topic and I'm very passionate about it. And it'll be really good to have pharmacists who are in prison to know even the basics, to know what to expect. So then they can actually maybe counsel patients who are in there. Tiny little things can help. So if we're looking at muscle strength training, what exercises are incorporated in prison to allow for increase in muscle strength training, which will help with bone health, which will help with mobility as you get older, because the more mobile you are, you live longer, healthier. So these tiny things, they can have big impact.
That is very, very useful to know. And just to go back on one of your points, you mentioned that different ethnicities experience menopause in different ways. Would you be able to tell the audience a little bit more about maybe what you see in the different ethnicities? Because I think this is just so useful knowledge, and not just as a pharmacist, but any relatives, even any woman out there who just wants to know, or even any male out there who wants to know and thinks, do you know what, I've got a female friend going through this.
Yeah, definitely. For example, if you have Black African ethnicity, they're more likely to have hot flushes for longer. If we're looking at South Asian women, we're more likely to have vaginal atrophy. If we're looking at things like sleep disturbance, that's general sleep disturbance that we do tend to feel, and it's felt more so in Caucasian counterparts. So different ethnicities will experience different symptoms for different lengths of time. The onset of menopause, so menopause be you haven't had a period for 12 months, and the day after you would say you've gone through the menopause, and then the day after you're postmenopausal. So actually, for Caucasian women, it's 51. And we say it's 51 because every study has been on Caucasian women. But if you're looking at, South Asian women, it's a couple of years younger. So it's like 47. And if you're thinking about perimenopause, which can last up to 10 years before you hit menopause. So that means you'll be going through signs and symptoms from the age of 37. So actually, your time frame of you going through these changes, it can be huge. 10 years, a whole decade, which is phenomenal, because you're going through these signs, these symptoms, it's getting worse, you're up and down. And once we've hit menopause and we're in postmenopause, our hormones are still declining. And then I think access to treatment is really important as well. HRT is really great. What we have in this country is really great. And I've spoken to so many women where, it's been a game changer, a life changer for them, because it's just given them their cognition back. The brain fog is gone. Suddenly hot flushes are manageable. So all of these things can actually allow you to live your life. So is there access for treatment for those women in prison? Because if they're having to, like you're saying, find accommodation, consider the family elements which may be looming for them, job and all of that, and then you've suddenly got all these things which are happening to your body. Actually, if you can provide them with treatment like HRT, super safe, making sure that it's individualized, because no two women need the same treatment, and actually that could really help them to get back into in a way that they want to. Then their physical symptoms, their cognitive symptoms may be managed, and therefore they're able to focus on all the things that they need to focus on whilst they're in prison or when they're out. So actually it can be quite life-changing for some women, 100%. And they should have that access to treatment.
They do have access to treatment for sure. Like you said, it's that confidence that the woman gets back, that, oh, I feel myself again.
Yep.
that I can now focus on doing this task ABC, or I
Yeah.
can focus on what my plans are for when I'm being released and things like that. I can navigate the world again, as it were. Yeah, I'm quite curious. I mean, obviously, no menstrual cycle is the same either. And women go through so many different things like endometriosis. And sometimes women don't even know themselves that they've got endometriosis. They're suffering all these pains and all these horrible symptoms. They don't know about it. Is that also, I mean, this might just be my naivety, but is that also what you'd see in menopause, those similar symptoms? How would that work for people with endo? Because I know it's very hard to live with that, not from my personal experience, but from what I've heard from friends.
Endometriosis, it's really hard to get any kind of diagnosis because of the fact that you do get aches, pains, you get cognitive kind of signs and symptoms as well. When it's hormone related, you will probably get similar sort of kind of presentations in terms of when it's hormonal. So I know a lot of women who have endometriosis also, and PCOS, for example, they'll have a lot of migraines. And that's something actually when you're going to the perimenopause to menopause, some women start to get migraines or their migraines get worse. So it's really one of those things with women like hormonal health. It's that thing with trying to understand your body. And I know it's really hard when it's endometriosis because actually it's like a roller coaster. Even getting to speak to a clinician who takes everything seriously and does the appropriate investigations and all of that. So it's hard enough as it is when you're out and about. So again, it's one of those things where tracking is really important when we're looking at our cycles. I don't know if you're the same, but when I was younger, I used to track my cycle all the time and I knew what was going to be happening when. And that's maybe because we're in the healthcare profession, I don't know. But for me, that's just something that I wanted to do and it just came naturally to do. And actually, that's something that I think all women should do. They should be taught to track your cycle, understand what's happening at what point in your body, because actually that will really impact how you're feeling as well. I don't know if I've answered your question, but when it comes to hormonal health, I would say the biggest thing is to try and understand your body. And I think women tend to know their body well. But like you're saying, it may be different for women who are in prison because there's lots going on.
Yeah, and GP appointments aren't easy to come by as well. I think a lot of people have the misconception, oh, you're in prison, you've got access to a GP, a dentist, physio, you've got everything there. But actually, everyone is competing for that same appointment as well. So it's not so dissimilar as it is from the community. Hospital appointments are another story as well, because it's not easy to get hospital appointments. You can't just rock up to A and be seen or go into a walk-in clinic. You can't do that. You are in a prison, you are very much dependent on the resources that are available in prison. And that is just how it is, unfortunately. Yeah. But then it does make me think as well that if women are going through certain things with their bodies, pharmacy professionals do need to be better educated about menopause, particularly those that work in women's prison as well, just so that if someone is stating that I've got low mood, you don't just think, let's give them an antidepressant. You're able to just ask them, okay, how have your cycles been in the last 6 months? Have you noticed anything different? And although I haven't worked in a women's prison, but I suppose now you're getting me to think about these things just in general day-to-day interactions with women. It's a very different way to look at things. I was just wondering, what do you think pharmacy professionals can do? What sort of resources are there available to us? What resources are there available to women themselves?
I think there's a lot of information out there on the internet. So I think it's important to go to reputable sources. There's the British Menopause Society, really good, nice, useful information there. There's also the Menopause Charity, which is great for your everyday person. They have all the information on there, and also they can interpret into different languages, which actually is really helpful for anyone. I think they've got every single language under the sun, which is really good. So I tend to tell my patients to go to the Menopause Charity because it's great.
They've got leaflets and things as well.
I think it's all printable, I believe. I might have that wrong, but it is all printable. Just that has such good information on there for even as a healthcare professional, even if you're just starting your information journey on there, that's great. There's the Balance website, Balance app. They have a lot of information on there as well. And it's all very digestible. I would definitely say those would be really good places to start as healthcare professionals. And also, it's good to know to connect the dots, because I've had patients who've come in when I used to work within GP land. I would have a patient who came in with dry eyes, right? So we treat the dry eyes. A few months later, she would come in with gut issues. Okay, let's give her some omeprazole and see how she gets on. And then after that, a few months or 6 months later, she'll come in with like joint aches and pains, like all of these things. And then actually when you connect the dots, is it her hormones at play? Because there's over 45 symptoms for perimenopause, menopause. So it's about connecting the dots, understanding, fine, you got dry eyes. Let's try and treat the cause instead of just the symptom, which is what we tend to do. And I think when we're looking at it holistically, it's so important. So if that woman came in with gut issues, we've given her omeprazole, but actually, have we counseled her on her diet? Have we counseled her on nutrition, which is so important to feel good and to be healthy? We want to be healthy for longer. Therefore, we need to invest and put the time in to do that. And I think it's also important in terms of the education for people is to understand that it's a journey. So even if somebody is put on HRT, it's still a journey. Menopause health is like a jigsaw puzzle. You have HRT that fits the puzzle. You have lifestyle in terms of exercise. You have nutrition. You have sleep. You have social connection. You have exercise. All of these things fit into a puzzle, and you have to get all those bits right. And if you think about all the bits which are involved, it's a journey. It's a positive journey, I say, because we're actually at a stage where you have to put yourself first. Otherwise, it'll be detrimental later. I know women in my family, for example, they went through it, but nobody spoke about it. And now they have so many joint issues. And now they have type 2 diabetes. But actually, if they've spoken about it before, then they could have changed things in their lifestyle or made a little bit more effort to do muscle strength training, which is horrendously important at this stage. Like I said, it helps support the bones, and that helps us be mobile for a lot longer. So these things, it's a jigsaw puzzle, and we need to understand that's how it is and actually look at it as a positive thing. I think it's a positive thing that you're allowed to, because you weren't before, to put yourself first and actually start to feel good.
That's very empowering. We should be looking after ourselves. We should be understanding our bodies. At least a takeaway definitely is that if you're not already, I would say track your bodies.
Yes, 100%.
I think that's a really, really good takeaway. I think people can do that.
Yeah.
Definitely applicable in prison. Get a pen and paper, write things down. If you're noticing certain patterns, if your peers who you trust, if they notice things, just ask them. If they're willing to be honest and you have that good rapport with them, write it down. If it's getting to a point where it's actually unbearable though, and it's probably affecting your day-to-day life, am I right in saying that's maybe the time you need to start thinking about escalating it to a healthcare professional?
Or even before, if you're starting to feel changes, there's no harm in seeing that healthcare professional and making sure that things are documented. You've got to advocate for yourself, but to advocate for yourself, you have to have the knowledge. Otherwise, how can you? This is why I think education is really important. In prison, I would definitely say education is the first kind of point of call, is getting these women to understand perimenopause, menopause, postmenopause, what it is, what's involved, what can happen. Because when you have that knowledge, then you can, number one, advocate for yourself. Number two, you're empowered with that information. And then you can start to think, nobody's going to know what your lifestyle is like, and only you know what things you can do, what sustainable changes you can make. And I think that's another important point is, I can tell you it's a jigsaw puzzle, but with experience, you can't change 10 things at once. It's not sustainable. It's not going to happen. It's small steps. This is why I say it's a journey, because if your gut isn't right, let's make changes to try and get your gut right. If that's okay, and then your sleep's not right, let's consider what we can do for sleep. Like some people sleep with the light on. Sleep hygiene is so important in this stage, especially. Make sure it is dark. Make sure you have a routine for bed so your body can start to unwind. We do that for babies, right? When we're doing sleep training for babies, we try to keep everything completely the same so that the baby knows it's time for bed and they can wind down. That does not change as we are adults. We need to have that set routine so our body starts to understand that, okay, it's time to wind down. And our bodies are very clever. They can pick it up very quickly and easily as long as we stick to the same routine. I think those things, again, once they become habit, then you can move on to the next step. So it's really important that we understand it's a journey. What you do at the start of your perimenopausal journey may be different to what you do 3 years down the line because your hormones have changed again. If you have HRT, then that makes it maybe a little bit more easier. But small things need to happen on a regular basis to allow it to be sustainable.
Hormones take ages anyways. For you to even see change in your hormones, in your skin, in anything, it takes a long time. It's not just 30 days, for example. It can take months. Some of the challenges that women may face in prison is maybe not always having the same routine.
Right.
They may want to have a routine, but you can't help certain situations. Let's just say there's been an incident of self-harm. There's going to be a lot of commotion, a lot of noise. These things can disrupt a person's routine. Like you said, knowledge is power. As long as people have access to that knowledge, they're able to ask, and then they can see, right, this is the setting I'm in. Maybe these are the changes that I can apply to where I am. If people are just given that support, that would at least help them. As I said, people may already be getting this sort of a support, or they may not. But I think it would be really interesting to hear, are there any peer groups at all? And how have they set these groups up? Are they keeping it trauma informed, for example? Like you said, trauma has such a big impact on women's health in general. It does shape our lives so much, and not just women's health, just generally. It impacts someone's life so much. And then if it's so deeply embedded into your bodies, it's going to affect your hormones. It's then going to affect the presentation of symptoms. You have to be wanting to understand yourself, wanting to help yourself. And I would say if you're in a better state of mind mentally, you will also be, to some extent, in a better state physically as well, and vice versa. But like you said, keeping that sustainable when you're in a prison setting.
Is there a prison which has got this right? They've started to consider women's health, consider hormones, and actually started working on it. And how has that worked? And if it's worked really well, learning from best practice, can we implement it somewhere else? So it'll be really good to actually see if that's even happened. I'm sure it has somewhere. And if that's something that we can start implementing elsewhere, just for these ladies to get the support that they need.
And in terms of medication, just the basics, in case anyone again is listening or watching and they don't have a clue at all, what sort of things can people expect are available? I mean, there is a little bit of restriction in medicines as it is in prison, just because the setting that we're in.
So generally, when we're looking at treatment in HRT, there's 3 hormones we're looking at, and that's estrogen, progesterone, and testosterone. But testosterone is something which is important. However, I would say the baseline to ensure that your estrogen and your progesterone level is correct first. So we have the body identical progesterone, which is the Utrogestan. So that's a capsule, and that's as identical to your body as you can get. And that's normally taken as a capsule at night. And the dosage is dependent on whether you're postmenopausal, whether you're perimenopausal, and if you've had a hysterectomy. So if you've had a hysterectomy, you don't actually need the progesterone bit. That's essentially there to protect your endothelial lining. Then you have the estrogen element of it. You can get that in a gel. You can get that in sachets, and that's to apply to your skin. You can also get patches. And these patches, again, will either be estrogen on its own, or you can have the combined patch. And essentially how it works is you'll have the estrogen element throughout, and the progesterone element is either cyclical, so certain days of the calendar month or certain days you would take it, and then you would have a progesterone-free break. So that tends to be how it works. You can also get the oral HRT. I don't tend to prescribe that because it's synthetic, and a lot of the patients prefer to have the topical preparations. So there's that. With testosterone, actually, it's not licensed in this country yet for HRT, although I think that's changed actually, but it's not been approved by NICE for it to be prescribed on the NHS. The MHRA have approved it for HRT, but obviously it's not available through the NHS because NICE has not approved it. So there's that element of it as well. But it's a question of getting the dosage right for you. I have a lot of patients where one person will say, oh, she's on 3 pumps of estrogen and I'm only on 2. But I'm like, okay, but do you feel good? She's, yeah. So then you're fine, right?
Yeah.
If we wouldn't give everybody the same blood pressure medication dosage, if something's working for somebody, or if a preparation is working for somebody and it's managing their blood pressure, we wouldn't change it because their friend is getting something else. So it's the same thing. It's super individualized. I would say the type or the formulation which somebody uses should be something which is conducive to their lifestyle. So if I have somebody who's very busy, I wouldn't necessarily say use the gel in the morning and then take the capsule because that's just too much. But then I would just say use a patch, and you would change that twice a week. So you don't need to think about it except for twice a week.
It just depends what is on the formulary in the prisons. Each prison has a different formulary. So that would be very interesting to see what they do provide, what they don't provide, and how that's helping women, how they manage that as well, and how women communicate that to prescribers to say, look, this isn't really right for me. Can I maybe try a different preparation? I don't know how that works.
I've had some patients who suddenly, out of the blue, they will just feel rage. They just don't know why, but they feel angry and they could just walk out the room and try and regroup. But if you're in a confined setting, that would be very hard to manage, I would have thought. Again, not knowing what's in place within prisons, but that I can imagine being really difficult to challenge and manage oneself. So yeah, I can imagine that being quite tricky. And this is why education is really important, because say if a woman knows that she's suddenly feeling rage because of her hormones, maybe she can find a quiet corner somewhere, I don't know, where she can just meditate or whatever helps.
I do suspect some women also mask what they're feeling, particularly in a prison setting, because you don't want to be seen as vulnerable. You don't want to be seen as a target.
I worked with somebody who was expecting and she was working really hard. And I was like, relax, don't worry. But she said, I don't want anyone to think that I can't do the work or I look weak. I was like, you're growing a baby. Like, you can't get stronger than that. And it's just the thing that we've either been taught or we've just put it on ourselves, whatever it may be. So that's obviously within the prison setting as well. Like, you want to not feel vulnerable in any way and you're able to do everything all the time, top notch. And it's something that happens generally, I would say.
For me, and maybe for the audience as well, some of the key things that I would probably be taking away are, if you're not doing already, track your bodies. Keep an eye on what you're eating. Keep an eye on your mental state. Keep an eye on your physical state. Are you getting enough exercise? Do you have access to exercise? I know they do in prisons, but sometimes the regime can change and things. So are they using their time in their cell if they can? But then again, I can also understand if they don't have access to showers. Just speaking out loud.
Yeah, no,
but yeah, all these sorts of things. But yeah, just track yourself, see what changes you can do, what modifications you can make. If you have family on the outside that can support you as well, maybe see if they can find out more information for you, and do what you can to educate yourself and escalate when you feel that you're not sure about anything, because it's better for that to be documented. And that's really important. I suppose I never saw it like that, but that's actually for their own protection as well. So yeah, is there anything else that I've missed off?
No, I think you've got everything. If they could all wear cotton, like I'm hoping they will, or they do, cotton's really good, breathable. Like, it's a very small thing, but actually can make a really big impact if somebody's going through some like hot flush or night sweats. I think they're so small. But again, there's constraints around things. So yeah, even some small things like that can really help. The only thing I would say is just knowledge is really powerful in this kind of sphere. And every woman should get the courage to advocate for herself, because no one else is going to look after you apart from you in terms of this stage. And really listen to your body. If you can, home in and zone in and listen to your body, because women do know their bodies really well, even though they've not listened or they really have the ability to do that and know when something's not quite right. So it's something that I would say to do for every woman.
So there we go. Thank you so much for your time and for coming on the show.